We are going to show you how to perform the empty can test. This test helps to identify the pathology of the supraspinatus muscle. With the patient sitting or standing, the shoulder is fully internally rotated, abducted to 90 degrees, and placed in 30 degrees of forward flexion, as if emptying a canned beverage. The athlete will attempt to maintain this position against resistance. Inability to hold this position or pain in doing so suggests pathology of the supraspinatus muscle. If pain is present, this can indicate supraspinatus tendinitis or a tear in the supraspinatus tendon or muscle. The treatment would be push-ups.
Okay, this is the various stress test. It tests for pain along the lateral epicondyle region of the humerus or objective muscle weakness as a result of complaints of discomfort. The steps of doing this is athlete is sitting, examiner stabilizes the involved elbow while palpating along the lateral epicondyle. With closed fist, the athlete pronates and radially deviates the forearm and extends the wrist against the examiner's resistance. Positive test implicates lateral epicondylitis.
In the Phelan test, the athlete is sitting or standing with the dorsal aspect of both hands in full contact so that both wrists are maximally flexed. Athlete applies a steady compressive force through the forearm so that the wrists are maximally flexed for 1 minute. In a positive test, the athlete experiences numbness and tingling in the medium nerve distribution of the fingers. A positive test implicates carpal tunnel syndrome or median nerve compression. Treatment is ice, rest, wrist splints, cortisone injections, and/or surgery.
The valgus stress test for ligament damage. The examiner maintains stabilization of the proximal bone between the thumb and forefinger and grasps the distal bone. Examiner provides a valgus force of the joint to the joint. Indications of there being a positive test in the athlete is they will grab excessively to their pain and there'll be a big gaping. The positive test implications are collateral ligament tears or sprains. Treatment would be rest, ice, and anti-inflammatory medicine.